Okay, awesome. So happy to take questions in the middle or at the end, whatever works for the people on the call. Urology is the speciality of the urinary tract, genitourinary tract. So of course, people are whole and nobody is just an orthopedic or just a urology or just a whatever. And so of course there's overlap in the systems. And so our two main overlaps is that in the female body, we only look after the urinary system. The genital system is looked after by the gynaes, whereas in the males we do genitourinary, and then also, of course, with the kidneys, that we share that space with the nephrologist. So there's got to be a clear distinction whether the kidney condition, whatever it is it a surgical condition? We need to jump in and intervene in a surgical manner, or is it a medical thing? So, but often when people out there in the community, because you can't really talk much about urology, right? They can't go into the details. When people ask what is urology, I'm like, we deal with the kidneys and bladder. All right, I just leave it at that. I leave the prostate out of it, testicular cancer, penile cancer, infertility, all of those things, erectile dysfunction. We're not going to talk about this to general folk, right? So just keep it, clean and above board. And yeah, it makes for very interesting conversations. So my big interest in urology was because it is so finite. There's literally two kidneys, two ureters, a bladder, a urethra, and a few accessory organs, right? So I like that about it, but I also like that it is, we deal with both males and females. We deal with adults in the pediatric community. We have, medical things that we do and surgical things. And certainly the surgery is interesting. And so I think some of the people that are attracted to urology, it is really about the surgery that we do. And truly, you are either a urologist at heart or you're not, right? You're not going to force yourself to become a urologist. If it doesn't appeal, then it doesn't appeal. So in the typical way of a surgeon, we talk about pre, intra, and post. So I figured that would be the approach that I would use. So prior to your getting onto the program, what needs to happen in the program, what happens, and following your training, what happens. So we often speak about the 6 Ws, except the last one is an H, the how, but they always refer to them as the 6 Ws. So I use this as an approach for my registrars because you guys will know, by now you should know, that for all speciality training, all specialist training in the country, we now have to have an MEd component. So we now have to have a research component. And this was made effective from 2011. There'd been a lot of talk prior to that. Should we, shouldn't we, how are we going to implement it? But eventually in 2011, it was passed through the HPCSA. So everybody who specializes must do research. So we do the MEd, and the MEd component then takes 4 years. So, medical masters, we do over the 4 years of your reg time, whereas other masters, like somebody who does a BSc and then they're going to do an MSc, that's typically, 2 years. Some people will get it done in a year and a half. But during your reg training, there's so many other moving parts that the Masters in Medicine takes the 4 years of reg time. So when the registrars first start with me, I will say to them in the first 3 months, when you start with me, I always say, I don't expect to hear anything from you about research. I expect you to walk around with a sense of wonder, everything that you do, as you're walking about, you're in clinic, you're in theater. I expect you to be, excited, curious, wondering, right? And then at the end of 3 months, let's talk about what is it that is tickling you, right? What is piquing your interest? And then we begin to craft it from that perspective. But so the 6 Ws are what, who, when, why, where, and how. So with regards to specializing in urology, for today, we'll just focus a little bit on the where and the how. The what is you, the what is urology, sorry, the what is specializing in urology in South Africa, the who is you, The when, I guess you determine, although not really, because there's so few urology posts across the country. Sometimes people wait for a long time before they get a post, right? So the when might not be as straightforward as you would like to believe. Why, that's your business, right? Hopefully you figured out why you want to do this. So we'll talk a little bit now about the where and the how. So there's 8 institutions in the country that offer training in urology. And it is as listed on there. And so those of you who did your undergrad at any of those institutions will have rotated through urology. I know University of Limpopo with their new, not so new medical school, but they don't have specialist training there yet. So I'm not sure what happens with like the specialist surgical disciplines at undergrad level, but certainly at those other 8 institutions, urology is very much part and parcel of what happens. I have a bone to pick because I feel that the amount of time that undergrads spend in urology is far too little, right? We cannot expect you to go out and look after urology patients and urology conditions when you've had literally only 2 weeks in final year. In most places, well, we have 2 weeks as well in 4th year. That's not enough. That's not enough, right? Men make up half of the population, so I don't understand why we are why we're paying so little attention. And some people will never do urology in their internship com service. And if you don't, then it literally means the last time you had formal training in urology is your 2 weeks in final year, which is really underserving the population that we should be. And that's where the policy makers, the decision makers, that's where we need to be engaging them, because I think we are severely underserving men, right? So before your training, what we expect you to do is for sure to have your surgical primaries. Some institutions insist on your surgical intermediates as well. So I did my I did my undergrad at Pretoria, but I did my urology at Wits, and Wits, they want you to have intermediates, right? It's just not up for discussion. Here we say that we will take you with primaries, but it actually makes your life easier if you come in with intermediates, right? So if you have intermediates, you're already one step ahead. But we won't not consider you if you don't have them. There was a point some few years back, we had urology specific intermediates. That didn't work out so well because we're just such a small community. There's about 300 urologists in the country, and that's like including registrars, including people who are retired, so really there's not nearly enough urologists in the country. And so the pool that was available for examinations to do the intermediate examinations as well as the finals was just limited. So we went back, because prior to that we had always done the general surgery intermediates, as most surgical fields, most surgical disciplines do. So we've gone back to doing the general surgery intermediates, which I think is probably better. We can teach you the urology in the 4 years that we have you, and it's 4 or 5 years. I'll come to that later. But in the 4 years that we have you, we can teach you the urology that we need you to have. But I think also because it is so difficult to get into urology, just in terms of the numbers and the long waiting time, that if you've done general intermediates, it allows you to go into other surgical specialities then if things are just proving difficult on the urology side. But I know a lot of people who are urologists at heart who will wait, right? You kind of know, like if you're a urologist, you're not anything else, and you don't want to be anything else, right? And things like your ATLS, basic surgical skills, basic suturing courses, all of those things, absolutely. You want to get close to a unit. So for like I'm saying, with the long waiting period, sometimes I didn't have to wait long. My things kind of worked out nicely. I spend time, as an MO, as a general surgery MO, and you're rotating all over doing ICU, doing trauma, And as soon as I'd written my intermediates, very soon thereafter, a post opened up. So I didn't have to wait long, but I know people who've waited like 2 or even 3 years. But if you're one of those that has to wait, and even if you don't have to wait, you want to get close to a unit, right? Because the competition is so stiff. You want to be known to a unit. And we understand that you're working elsewhere, you're doing other things, but if you can start attending our academic meetings, and a lot of like we have a language you hardly ever use, but we have a link that if you were to to have shown an interest but you're not able to come, if you come once a month or once in 2 months, whatever, you must just be a face that we know, that we kind of recognize that, okay, this person is serious about urology, right? You're not just kind of, trying here, trying there. So you want to show an alignment with what we're doing. You want to show an interest. So get close to a unit. Let them know you. Let them know you. Attend, a grand round once in a while if you can, an academic meeting once in a while, whatever it is.